Output 2.2.
Long member for Elwick.
Thank you, Madam Chair. My question to the Leader is in relation to 2.2 non-admitted services. During estimates, I asked the question, how many patients are waiting for anatomical pathology results and reports, and what is the average wait time for both? The question was taken on, or during the estimates, the Secretary said we are not aware of any wait lists for those reports. And when I suggested that I had information to suggest there were in the order of 1,521 outstanding reports, the Minister said this is not something I'm aware of. No. So the answer that has come back when it was taken on notice to confirm does confirm that there are over 1,787 unreported cases currently. So my questions in follow-up are, why were the Minister and Secretary unaware that there were any outstanding anatomical pathology reports when in fact there are 1,787 currently unreported cases?
Madam Chair, in regard to your question, Honourable Member, they are clinical issues and they are managed in that area on a day-to-day basis, and that's why the information wasn't readily available. But I can assure the Honourable Member that there is a clinical plan to have those numbers reduced.
Member for Elwick.
Thank you. My follow-up question to the Honourable Leader is, should Tasmanians be concerned if they have symptoms that require anatomical pathology testing to diagnose? For what conditions would someone require anatomical pathology reports, and what are the potential impacts of patients waiting 7 days to 14 weeks for a result as per the current average wait time, it being 7 days for Category 1 urgent cases, 8 weeks for Category 2 semi-urgent cases and 14 weeks for non-urgent cases? Does this mean that undiagnosed cancers could progress, resulting in worsened prognosis or even morbidity while people wait?
Honourable Leader.
Thank you, Madam Chair. The urgent cases are reviewed, so it's just the reporting that takes longer. So you can be assured that the urgent cases are reviewed in a timely manner, but it's just the reporting that can regrettably take longer.
I'm in for Rumney.
Thank you, Chair. Thank you, Leader. I was just hoping you could explain the difference between reviewing and reporting, what reporting means and who it's reported to, just to explain what the difference is between those timeframes and those two parts of steps of the process.
Honourable Leader.
Thank you, Madam Chair. In regard to the review, there is a discussion with fellow clinicians. So that's what happens with the reviewing of the information, and then the reporting is the written report that's attached to the outcome of the diagnostic assessment. So that's where the difference is. There's the review takes place, and that happens between fellow clinicians, and then the reporting aspect is what follows. I'm advised that some of this information, I'm not sure whether it was all discussed, but there was a level of discussion during the estimates process around this.
Honourable Member for Rumney.
Thank you, Chair. Thank you, Leader, for that response. But with respect, it doesn't really add a lot to say that the reporting process means there's a report. My question was, who is that report to? Further to that, at what point does the patient and their treating doctor become aware of anything that might be identified through that testing process that needs further treatment? Because if that's the point of where it's reported and that's where the patient finds out about it and that's when treatment might begin, then that is concerning that can be taking quite lengthy periods of time. It sounds to me so far, and I'm hoping you might be able to tell me something different, but it sounds so far that the review process, which is the bit that's happens more quickly, is not the point where treatment might begin or treatment options might be discussed with the patient.
Pass it on to the...
Leader.
Thank you, Madam Chair. At the time of the review, if there is an issue, then that is communicated orally to the treating clinician immediately. And if it's an urgent matter, then the treatment is also reported verbally and that treatment commences immediately. It's just around the reporting, the actual written report is something that takes a longer period of time, but you can be reassured that there is those immediate discussions with the treating clinician.
Honourable Member for Elwick.
So, thank you for that further explanation. My final call, I think, so my final questions
Yes, it
are,
is.
what is the cause of the backlog and what specifically is being done to address it? And again, why were the Minister and Secretary unaware? Simply saying that it's a clinical matter doesn't appear sufficient when there is such a significant backlog to explain why the Minister and Secretary were unaware and what governance processes are now in place to ensure the Minister and Secretary are aware of significant issues in our health system such as this.
Honourable Leader.
Thank you. The cause of the backlog is around, there's some clinical directors who are doctors and they manage the risk. And so the Minister and the Secretary of the Department, they rely on the clinical directors to provide the level of risk information to the Secretary. There's a minute. In regard to the cause of the backlog, the clinical directors hadn't identified the level of risk that required the minute to the Secretary in previous instances.
Any requests? Can I just get Rosemary?
Is this one mine? Yeah. Oh, sorry. Sorry, I was going through looking at mine. Sorry, Ruth. Honourable Member for Murchison.
Thanks, Madam Deputy Chair. I've been listening to these responses, and I think it's really important we clarify here. I think something that's been said by the leader may not be entirely accurate, in that, as I understand it, having worked in the health profession a long time ago now, but when you get an urgent pathology report or a review of a report, that a test is done or a sample is taken or whatever it is that's to be reported on, should that indicate that a patient needs immediate treatment, surely we would see an urgent report prepared at that point. I cannot believe that you would expect a medical professional, a clinician, to instigate treatment without a written report. And that's what's been suggested here. And because I think that would be a very uncomfortable position for a clinician to be in, to instigate, particularly with some sort of authorised treatment that need an authorisation to initiate, that they would not be able to do so without a written report. Now, it is concerning that we've got urgent cases that are not meeting the required deadline or the stated deadline for reporting, up to 7 days. Now, that's not okay. Immediate treatment is immediate treatment. Immediate is as soon as it can be reasonably delivered, because sometimes it may be that the medication is not available immediately to be given to a patient, or the surgical procedure can't be done right there, right then. But whatever it is, I find it not a reasonable expectation that a medical professional would initiate treatment on the basis of a verbal report, except in very extraordinary circumstances. And I would expect that there would be an urgent report written, even if it was just a preliminary report, to give that medical professional the guidance and the basis on which to establish the treatment. Otherwise, the risk of medical liability claims if something goes wrong, or other things. So I'd want other issues with not being able to administer or deliver a particular treatment because you haven't got the evidence it's warranted. So I would like the leader to clarify this matter, because I think what's been said, I'd be very shocked if that actually occurred.
Honourable Leader.
Thank you, Madam Deputy Chair. Yes, the urgent matters are reviewed immediately, and if treatment is required, then it is verbally reported, but there is also a report provided immediately. And if there is no treatment...
To be clear, a written report.
A written report. And I perhaps didn't say that because I was trying to write as I was being advised. From now on, advisors will be writing and I won't be writing. So I apologise if that came across as that there wasn't a written report that is attached to an urgent matter that has been reviewed and then requires urgent action. And if there's no treatment, then that's verbally relayed, but there's a follow-up report at a later time.
Any requests? The Honourable Member for Rumney.
Sorry, Leader. Sorry. Thank you, Deputy Chair. Thank you, Leader. I'm sorry, I'm a little more confused now. So I just want to clarify the report that you're speaking about now with urgent cases where there is something identified that requires treatment or follow-up, and a written report is prepared and put into the system. That's the reporting process that you were talking about in your first answer. And if so, can you confirm the time that those reports, and is that the same thing? There's only one report, I'm assuming, that one reporting process, one report for urgent cases, non-urgent, the three categories. Can you just confirm, particularly for those urgent cases, the time frame that that's taking?
The Honourable Leader.
Thank you, Madam Deputy Chair. The timeframes are an average of the 7 days, but for immediate action, the reports are immediate, although they may be interim reports. So there would possibly be an interim report at that point, if there needs to be immediate action taken.
Any requests?
Of course.
The Honourable Member for Montgomery.
Thank you. Just want a clarification on what the cause of the backlog was or is, and what's being done to address the backlog.
The Honourable Leader.
In regard to the backlog, there's been vacant anatomical pathologist roles, so haven't been filled, and the solution is the recruitment plus an increase of 2 of those positions from the state budget to address the backlog.
Any requests? The Honourable Member for Murchison.
Thanks, Madam Deputy Chair. Just to follow up on the number of cases, and I do make the point that if this information had been known at the table, we wouldn't have to do it this way, but there we go. As the member for Elwick pointed out, in response to the question we asked, there was 1,787 unreported cases. We've clarified what that means in terms of how the results are reported verbally earlier. The average wait time for the anatomical pathology results is 7 days for Category 1. Now, when I look at the note related to that, Category 1 are urgent cases, and the expectation is they're allocated within 1 to 2 days. So the question is, what does allocated mean in that sense? And how? And I could go through with there's 8 weeks wait for average for Category 2. These are the semi-urgent cases, and they're to be allocated within 7 days, which is a lot less than 8 weeks, obviously. Again, the same things apply. And when the number of cases here, we didn't actually get a breakdown of how many were in Category 1, 2 or 3. So I'm interested in whether how many are in each category, particularly the urgent cases, obviously. So the questions are, can that information be provided? What does allocated mean in that sense, and how many are actually allocated within that expected 1 to 2 days in the urgent case?
Okay.
The Honourable Leader.
The allocated means that there's a diagnostic test done, and the anatomical pathologist is allocated to review. So that's the urgent cases in that Category 1. In regard to the numbers, as the Honourable Member has requested, as of 3 days ago, the clinical director advised that the numbers were back to around 1,500, but it is a moving number. It's quite fluid, that number. I mean, obviously, when this answer was provided, it was 1,787, and then just 3 days ago it's back to 1,500. And so those actual breakup of category 1, 2 and 3 is not available at this point in time because it's such a fluid number.
Any requests? The Honourable Member for Murchison, third call.
The question wasn't the overall numbers, it was about how many in category 1 the urgent cases are allocated to the pathologist to report, which is what you've just said, in 1 to 2 days. Like, are we meeting a benchmark there or are we failing there as well? So there's a couple other questions I've got.
Do the other ones while you've got a call?
Yeah, this is my last call.
Yes.
Yeah? So, I mean, whilst this seems to be setting an expectation that for the urgent cases, even though they're waiting an average of 7 days, they'll be allocated to the relevant pathologist in 1 to 2 days. How many of those, how many are in that category, we don't know, but how many of those we probably don't know either, because we don't know how many there are allocated within 1 to 2 days. So to follow on from that, that's probably not able to be answered, but I'll put the question anyway. But what is the benchmark then for KPI on these timeframes? You know, what is our expectation, and how, do we measure against any benchmarks here? And the third question is, how are patients categorised into category 1, 2 or 3 in terms of where they fall? How is that assessment made? I know it'll be a clinical decision, but on what basis? Is it because of the symptoms they're experiencing? Is it because of the actual test itself and the result? Or what is it? What is the basis for which the patients are categorised as urgent, or their results, urgent, non-urgent, or semi-urgent or non-urgent?
Honourable Leader.
Madam Deputy Chair, all of the category 1, the ones that are the urgent cases that are allocated within the 1 to 2 days, they all are allocated. That's a definite. They're all allocated. In regard to the benchmarking, the KPIs are 100%, and obviously that's not being met. It's not being met. In regard to your question around how they're judged, how they're assessed, they're clinically triaged, and there's a need for the diagnosis based on the symptoms. It is, and I've been given an example of if it's symptoms for lung cancer, then the determination is immediate. And that's an urgent matter. So that's just one example of where the symptoms for lung cancer would be immediate action. I trust that is somewhat sufficient.
Any requests? The item is agreed to.